And joining us now is In Focus Health correspondent Lino Madu. What do you have for us today, Lino?
Hello, Dimiake. Well, a European study has concluded that inserted fecal material from a healthy person into the gut of somebody with severe diarrhea may cure the problem better than antibiotics. The study, which appeared in the New England Journal of Medicine, involved patients who had repeated bouts of diarrhea caused by a bacterium known as Clostridium difficile, or C. diff. In the small study, one transplant of fecal material from a volunteer with its mix of healthy bacteria resolved severe diarrhea in 13 out of 16 volunteers. Standard treatment with an antibiotic in comparison worked in 4 of 13 patients. About 3 million people in the U.S. are infected annually with C. difficile. It spreads mainly through hospitals, nursing homes, and doctors' offices. Now joining us via Skype to help us understand this study is Dr. Matthew Shiorba, Assistant Professor of Gastroenterology at Washington University in St. Louis, Missouri. Dr. Shiorba, welcome to the program.
Hi, Lenore.
Hello. Thank you so much for joining us. Before we talk about the study, tell us a little bit about this bacteria, C. diff, which causes severe diarrhea. How difficult it is to treat, and can it be fatal?
Sure. Well, certainly C. difficile infection has become really the scourge of hospitals these days in the U.S. and around the world, largely for the fact that it's a bacteria, it's a spore-forming bacteria that secretes a toxin and causes a severe diarrhea. And many times this begins after patients take antibiotic therapy. And since antibiotics are commonly used, obviously, in medicine, we've seen a rapid rise in the amount of C. difficile, both in the U.S. and around the world.
Now, antibiotics is the way that has been used to treat this condition, but with this new study, it talks about using feces from someone to another person. I have to say it's a bit unappealing as approach, but you did not take part of this study. You are, however, working on a similar experiment. Can you tell us about it? Help us to understand this.
Yeah, I'm sorry, Lenore, you're cutting in and out a little bit with that, but I think you asked about our experience with this?
Yes, the study, help us understand this experiment about taking feces from one person and inserting into someone else.
So maybe I can just summarize the study a little bit, Lenore.
Yes.
And if your office wants to give me a call on the phone, that's fine too. But basically in this study, so we've known, and in fact, it was first described that people had done fecal transplants. So basically taking a stool from one person who is well and putting it into somebody who is ill. And this was first reported in the 1950s. However, it was mostly over the course of the last decade or so that we've seen anecdotal reports where initially physicians in Australia and then here in the U.S. as well began using this in patients who had refractory C. difficile infection. And however, we've never had a controlled trial before. So the trial that was recently published in the New England Journal of Medicine is the first controlled trial where they had groups of patients that underwent either traditional therapy where they got antibiotics to treat this bacteria, or those that got the fecal microbiota transplant or the stool transplant.
Okay. And quickly, in 5 seconds, who will make a very good donor? A healthy person?
Who makes the ideal donor?
Yes.
That's a great question. We don't exactly know. I mean, at this point, mostly the blood or the screening for donors has been similar to what we've done for patients who are blood donors, although they've included some additional things. So people get tested for syphilis, hepatitis, HIV, these types of things. But the exact protocol of where this will be in the future is yet to be determined.
Thank you so much. That's all the time we have. Thank you so much for joining us, Dr. Shiorba.
Okay.
And that was Dr. Shiorba with Washington University.